Well, I just really want to thank Chairman Walker of the RSC Republican Study Committee. I greatly appreciate your leadership on this event here tonight, as well as the great job you're doing on that committee. So, you know, we've had alternatives to the Affordable Care Act ever since I've been here. The American Health Care Reform Act, as put forward by the Republican Study Committee, has many of the elements we've all been talking about for several years, with the Affordable Care Act being forced upon Americans, not in a bipartisan effort, strictly by votes of one party when they had the majority to force it through. And we're suffering the effects of that now. One of my colleagues earlier was talking about, why isn't this reported? Why isn't this being talked about in the broad sense of how it's really affecting the Americans that are paying for it? People in my district, ever since I've been a member of this House, are pleading with us to do something about these high premiums, the high deductibles, the lack of access they have, especially for rural areas. Why are we continuing to prop up what is proponents? Why are the proponents continuing to prop this up? It's clear that it doesn't work. Higher costs, less options, unworkable plans. The exchanges we watched in several states, most of them, after billions in investment, are shuttering. They're closing up shop. Where do those billions go that we've invested as a country into these exchanges? But on a patient level, it's putting even more of our most vulnerable patients on a system already known to be unsustainable without even ensuring access to quality care. There's no care at all. How are people defining that as a success? We know a main reason why so many people are uninsured is the high cost of coverage. But instead of investing vast amounts of money to bring more people into a broken system, let's take this opportunity to start fixing the root of the problem. This is by increasing competition, giving patients more options, choices, Mr. Speaker, choices. Give them a menu of options they can pick themselves, tailor the plan to what they need. A 20-year-old young man's got a complete different need than a 30-year-old mom and her family. Let them have the choices. Get rid of the costly mandates, the taxes on everything that seems to help prop up Obamacare, the Affordable Care Act, including the costs for students for college. They're paying for some of that. Let's build off successes that we've seen in the past and that are part of the proposal of the Republican Study Committee and the American Health Care Reform Act. That could help fill our gaps in the health care delivery system. Community health centers, for example, is a model that is both cost-effective and efficient in expanding access to care services in underserved areas, very rural ones, such as my own district at home. The health care reform affects the lives of every single person in this country, which is why it's high time we put the health and well-being of the American people ahead of partisan politics and legacies. Let's get to work and deliver actual solutions that empower patients, drive down the costs, and increase access to care in every part of the country. Let's give back to Americans. Keep your plan that you liked. Keep your doctor that you liked. So, folks, it's time. Time to stop the partisan squabbling over it and the deception that has gone on for what is indeed for some a legacy, a bad legacy of the American people. Mr. Chairman, thank you for your efforts on this.